In a Fox Carolina investigation, a medical center in Elberton, Georgia says they made an honest mistake. They gave out the COVID-19 vaccine to people not included in the current phase eligible for vaccination.
So they now face a 6-month suspension from this. This is from the Georgia Department of Public Health. Fox Carolina's Carrie Weimer was in Elberton today, and she has more on this developing story.
For the next 6 months, this facility will not be able to administer the first dose of the COVID-19 vaccine. This is all according to the state public health department. We talked to employees here today to find out why that is and what they have to say about it.
Once we were completed, vaccinating our healthcare personnel in long-term care, the next logical group is going to be, phase 1B in that group, which, by CDC's definition would be the essential workers, which included law enforcement, other healthcare personnel, but also educators.
Dr. Poon, a physician at the medical center, says their facility is now suspended for 6 months in the state's COVID vaccine program by the Georgia Department of Public Health, because they began administering the vaccine to the next eligible group.
The terms of the suspension are that we cannot receive any new doses for the next 6 months, and we can only use our remaining doses to administer second doses, so we can't do any new first doses.
DPH says they were notified Tuesday that the facility had vaccinated people in the Elbert County School District who were outside of the current eligible phase. According to the DPH website, the state of Georgia is currently still in phase 1A, which does not list educators.
CDC, as far as their guidance for rolling out vaccines, has never really said that you should stop and pause at each phase. That it should be a continuous event, that you're vaccinating as you finish with one priority group, then you move on to the next, and they can sometimes overlap by their wording.
The physician says once they were finished with their group of eligible participants, it made sense to them to move on to the next group to get the community vaccinated as fast as possible.
There was nothing in their initial policy that they provided us that made us even think that we had to stop and ask for permission to move.
Based on the guidelines that we had available to us at the time that we started administering the vaccine, no, I do not believe we have done anything wrong.
The DPH says the facility will not receive any new doses for 6 months, but they are allowed to use their inventory for those eligible for a second dose. The center says it has approximately 4,000 doses in inventory, but will only administer 600 of those in the next 2 weeks.
But there again, that leaves the remaining doses sitting on the shelf, and we are now waiting on the state to tell us what to do with these doses.
Lesson learned that as far as state guidance, we're going to be much more strict about that, and I guess we're just going to have to move slower. But unfortunately, I think there's certainly a level of mistrust we have now with the DPH. We thought we were in this together. We thought we were working for the same goal of vaccinating the citizens. It was never a race to be first. It was a race to get everybody done.
We've reached out to the Georgia Department of Public Health to find out what their plan is for the remaining doses that are still left here. We haven't gotten comment back, but once we find out, we'll be sure to update you. Reporting in Elbert County, I'm Carrie Weimer, Fox Carolina News.